Hey folks, my name is Sevtap Savaş. I'm a cancer scientist, professor, and advocate at Memorial University of Newfoundland, St. John's. This is a pre-recording of my talk to be delivered as part of the Canadian Cancer Research Alliance conference to be held in Calgary in early November. So the topic of my talk is the increasing trends in cancer in young individuals. And I'm going to focus on this topic as an advocate. Before moving on with my presentation, I would like to say that I have a number of roles within and outside of my primary institution. The key ones are noted here. I just want to say that I don't represent any of this today. So what am I going to talk about the cancer and young individuals as an advocate? So I'm going to touch 4 topics. First, importance of scientific data and knowledge in informing us about what's going on in our population and how we can plan to address these problems in the future. I'm going to talk about dismissal of symptoms, which is coming as a key point in experiences of people with experience in this demographic group. I'll also talk to you about the importance of advocacy, both at the individual and systemic levels. And the key message that I want to say today is that we really need a healthcare system that is proactive rather than the reactive one that we are facing right now. So let's start with the first one, importance of data and knowledge. We today know that there is an increased risk of certain cancers in young individuals, younger than 55 years of age, thanks to some data created by institutions or units. For example, in Canada, we have territorial and provincial cancer care registers. They do keep records of diagnoses in their area. Globally, we do see similar pattern as well. So the first thing first, we really need to understand that this kind of monitoring, surveillance are key, collecting data, watching, following up. So these are the key things that help us see what's going on today. We know today that thanks to this kind of data creation, that the incidence of certain cancers are increasing in young populations. And this information is useful. And it should be useful for everyone. For example, for funders, this knowledge informs them to maybe allocate their funding to this topic more. Maybe it helps the healthcare system. It should definitely help the healthcare system to deliver better care and service to this demographic group. And it can also empower the people at risk because they may want to know about what's their risk is, what's going on, and how can they better protect their health and well-being. So it's really great to have data and knowledge. With the second thing I want to talk about is dismissal of symptoms. This is one slide that I'm going to really focus on because we heard it from a lot of different young individuals. Symptoms may be dismissed by both the individual itself or the healthcare system. So let's see some examples. For example, I met with a young woman who was diagnosed with colon cancer. She had some symptoms, but she had 2 young kids, so she never prioritized herself over their needs. Or there was another young person who was diagnosed with rectal cancer, but thought that that was hemorrhoid. And my own sister, for example, was diagnosed with stomach cancer, and she was losing weight, and she was actually happy about it and thought that it was a stress. So there are a number of different reasons why we can dismiss our own symptoms, but some of them I noted here. Cancer usually doesn't have specific symptoms. And sometimes we are so scared of cancer that we don't want to think about it, or we don't want to relate our symptoms to it. And sometimes we are told that cancer was old folks' disease. Now, if you look at Canada, Canadian cancer statistics, 90% of the cancers are diagnosed in individuals 55 years and older, but the remaining 10% are those younger, and this numbers is not increasing. So nuances are important. Cancer is not an old folks' disease. On the other spectrum, healthcare providers may also dismiss our symptoms. How many times we heard young people diagnosed with advanced cancer that they were too young to have cancer, or the physician looked at other possible reasons. For example, I know someone who was diagnosed with stage 4 colorectal cancer, but their physicians were looking at the other reasons, for example, inflammatory bowel syndrome before they were diagnosed. So I don't know. I don't know why dismissal occurs in the clinic, but maybe our physicians need some education to keep up with the upcoming trends like this. Or maybe they were also taught that the cancer was old folks' disease, and or maybe they have little guidance to guide their decision making in such situations. So it's really tough, but it should be fixed because dismissal of symptoms do not benefit anyone. So I'm going to give you a good example. Dr. Robin McGee, some of you may remember, she was a very powerful advocate for the cancer community. She had positive symptoms, but she was denied further diagnostic procedures because of her age, and as a result, she got diagnosed with advanced cancer, and she became an advocate, but eventually lost her life last year. She is very much missed. So this is a very sad example of how the dismissal of symptoms because of age can lead to such a devastating situation. Robin once told me that I have led people to the promised land, but I couldn't enter the promised land myself. So I keep thinking about her words. Again, dismissal of symptoms do not benefit the patient or healthcare system. And I should also mention that Robin actually sued the physicians for malpractice, and she won. Advocacy can also be important. That's a really important point. And we actually see success stories about young people advocating for themselves in the clinic and getting the care that they deserve. I know one person like this, Liam Matlaluk. She's an indigenous nurse from Northwest Territories. She was successful, able to advocate for herself and get the diagnosis without delay. And she's a great advocate as well. So that's amazing that she got, but I keep thinking about, the patients need to do extra work. Do they need to advocate for themselves to get the health care that they deserve? The answer is a clear no. You also need to be aware of the fact that not everyone can advocate in the group, and there is still a large chunk of our society who cannot even access the healthcare. So how can we expect them to actually advocate within that healthcare system that they cannot access? So I really truly believe that we shouldn't um, we shouldn't load the task of advocating in the clinic to get the best care on patients. Rather, we need a system that advocates for the patients and reach out to patients and say, hey, here are what I can do for you. How can I help you? This is a system I'm looking forward to. And it may happen because I know systemic advocacy is also working, folks. I know there are a number of different organizations, Canadian Cancer Society, Colorectal Cancer Canada, Dance Breast Canada, and other organizations. They are really working hard to improve things for people. I know Canadian Cancer Society and Canadian Colon Cancer Canada are advocating for lowered age of screening for colorectal cancer as well. So I believe that this is going to happen, and it's going to help those young individuals at risk of developing this disease. I know that because in the past, systemic advocacy actually changed things. For example, in government of Newfoundland and Labrador, last year, the government reduced the breast cancer screening to 40. And that was thanks to the advocacy, I believe, by the Canadian Cancer Society. So that was great, but folks, at the same time, the Canadian task force said that they didn't recommend reducing the age of breast screening. So Canadian task force is the one that actually, gathers evidence and provide clinical guidelines for clinicians to follow, I believe. So, what do we see here? What do we see here? We do see that a clash between evidence-based guidelines and patient-centered care. Because, what I understand from patient-centered care is that if I'm a patient, if I need care, I need to get it in consultation with my physician. But on the other hand, physicians may be following the guidelines that are provided to them. So when they conflict, what happens? I think this is an answer. This is a question that deserves an answer. So, folks, we have to admit that our healthcare system is not only under stress, but it's also geared towards being reactive and proactive. So this is the final key message that I want to tell you. We really need a change, transformation in our healthcare system. We really need to focus on early detection, precision in early detection, precision in prevention and risk reduction. We are heavily focusing on treatment. Even the research is so focused on treatment in cancer. We need to focus on other areas where people will not need extensive treatment, because at the end, healthier people make healthier societies and economies. We definitely need increased health literacy and empowerment. So, and again, the data and science, etc., these are all providing these kind of opportunities for us. We also need to aim for precision in risk reduction and early detection in cancer and other diseases. We really need to be proactive. I'm looking forward to healthcare without needing extra advocacy or extra work on the patient side. And during the transformation of our healthcare system, hopefully this will also be integrated. We certainly need federal strategy and funding for a proactive, agile, and adaptable healthcare system, which can integrate new developments like this new trend of increasing cancer risk in young individuals. And I also think that we really need to examine what patient-centered healthcare means and the role of guidelines in providing care. So with this, I am going to end my presentation. Thank you very much, folks. Hope it's useful, and you can always contact me at my email, savas@man.ca. Thank you.